Scenario. Mr. John, a 32 years old man, has a meniscal injury due to trauma. He came in today for an arthroscopy operation. Please know that he has had previous operation cancelled. Introduce yourself as the surgical doctor responsible for Mr. Jack. Use clear and empathic communication to explain Mr. Jack's condition. Address Mr. Jack's concern and answer any question he may have.
It should be Mr. John Ahmed. I just updated it. It should be Mr. John.
No problem, Mr. John or Jack.
Yeah, but we started with Mr. John and I made you Mr. John now. It's clear, Mr. John. Okay.
Yeah. At the scenario, Mr. John, yes. And provide reassurance, support, and guidance. So let me put the timer. We can start.
Hello, good evening. My name is Muhammad.
Good evening, doctor.
My name is Muhammad. I am one of the surgical doctor working here. It's very nice to meet you, Mr. John, and I will be your doctor to update you about your operation. If that is okay?
Yeah. That's fine, doctor. I just want to know, is it my turn now for the operation, doctor?
Mr. John, it will be great to have your operation today. Unfortunately, we have emergency case, and your operation will be postponed.
What do you mean by emergency case, doctor? What do you mean?
Mr. John, your operation is very important.
Yeah.
But unfortunately, we have emergency case that require immediate attention. I'm sorry for this.
Okay, so my case is not emergency, as you're saying.
Well, I understand your frustration, Mr. John, but your case is an elective operation.
Yeah, but it's very important to me.
Yeah, it's very important. I can see that you have your frustration.
Okay, okay. Would you call my consultant, please?
Mr. John, I'm sorry, I cannot be able to call the consultant because he's busy with the emergency.
What do you mean you won't be able to call him?
Yes, I cannot be able to reach him at the moment. He is very busy with the emergency.
Okay, can you ask another consultant to do my operation then in this case?
Mr. John, I'm glad that you asked me, but you should know that if we call another consultant, this will be he will need to review your case from the start.
Yeah.
And that will consume a time also, and that will consume a time.
To be honest, Dr. Muhammad, with all due respect, from what I see, I don't think you have any solution for me. Are you able to do it yourself then?
Yes, I understand your frustration, Mr. John, but I am not. I should not do operation without supervision.
Aren't you a doctor?
Yes.
Okay, why don't you do it then? What are you rambling about?
Yes, I understand, your frustration, Mr. John, but I should have supervised. I should be supervised with a consultant to do such operation.
Oh. Okay, give me another appointment then, doctor. Please don't tell me you cannot even do that, please. So you have all the excuses in the world and not a single solution. At least give me an appointment, please.
Yes, I am sorry for that, Mr. John, but I will discuss your case with my consultant, and I will make sure that your case will be prioritized for the next possible appointment.
No. Look, doctor, I'm just gonna be clear. Don't say vague sentences that has no meaning to it. Give me another appointment so I can go on with my life, doctor. I'm in severe pain.
Yes, I am so sorry for your pain. If you would like to, I can provide you with the painkiller for now. But Mr. John, I cannot be able to give you exact appointment at this moment, but as I explained for you, I will call my consultant and
But
we'll arrange.
that's nonsense, doctor. That's nonsense. How I will be able to work now? That's nonsense.
Yeah, I'm glad that you mentioned that, Mr. John. I can write a medical note explaining your situation for your employer, and even I can give you, I prescribe you a painkiller, and I can refer you for the physiotherapist.
Which is not helpful, to be honest. Can I walk on my legs, doctor, still? Can I put weight on them, even though I'm in severe pain?
That is a good question. I'm sorry for your pain, but I can prescribe you a painkiller, and I can also refer you for physiotherapist.
But you didn't answer my question, doctor. Can I still walk?
Yeah, Mr. John. Sorry, now I can understand you. Uh, for sure that you will have some discomfort and pain. In your case, it's better to stay active and do some exercise like swimming and cycling. And also,
All right. All right. Listen, doctor, this medication you give me for pain relief, it always causes heart pain. What you gonna do about that?
Can you please tell me what you exactly? I'm glad that you mentioned that, Mr. John. Naproxen will cause this heart pain, so it's better to stop it, and I will give you another medication that it will help with this situation.
Yeah, but I'm not happy with all of this. This is my fourth time coming here to you guys, and you always cancel my operation. I think there's element of negligence around here, and I think you guys don't care.
Yes, I apologize for that. I understand your frustration, but we really care about your case, Mr. John. So let me inform you that we will reschedule your operation, and I will contact you as soon as that it will be
No,
possible.
I want to file a complaint, doctor.
Yes, Mr. John, it's your right to file a complaint. You can file complaint in the patient service office, and I will guide you for
What's the name of the office again?
patient service and liaison office.
Okay, all right.
Service.
All right. Can you tell me how is the arthroscopy done?
Yes, I'm glad.
Hopefully, one day you will do it. Hopefully, even though I doubt it.
Yeah. I hope that, Mr. John. Thank you. I'm glad that you asked that question. The arthroscopy exactly that we will do a keyhole inside your joint, your knee joint. It will be guided with the camera so that we can look inside your knee, and we can proceed with your operation.
Yeah, that's fine, I guess.
Okay, Mr. John, can you please now summarize what we discussed so that I could make sure that you capture all the points that we.
Yeah. You canceled my operation for the fifth time. Obviously, you don't care, and you said your consultant is busy with the operation. You gave me all the excuses in the world that you will not be able to do it, and you can't give me an appointment. However, I will file a complaint, as I said. I'm just gonna make this very clear.
Time up.
Thank you.
All right. حكاشة شغل فخيم يا ولدنا. والله انا حق اقطع عليك دي اخذت عليك comparison to the very one. Very good.
Thank you.
ما في كلام والله.
Yes, عمر الحمد لله على السلامة. Welcome back.
الله يسلمك.
Welcome back, عمر. Welcome back.
اسمع كلامي؟
I hope I did well.
Very fantastic. Nice.
Very calm.
Just
I actually go back to the last video. I discovered that the posture is important, and you should listen. You should listen for your patient. Take care of him,
and then absorb what your patient says before you reply.
Yes,
that's very important. You did a good job. That's a very fantastic performance. With a small grammatical mistake which will not affect your score at all. And for example, you said I can't be able, so you should just say I'm not able to do this or I'm not able to do that.
I am not able.
Just 1 second. So you I can't be able to, I'm not able to. It's not I can't be able to, I'm not able to do that, or I'm not able to do that. And I'm giving you this sentence even for your life when you come here, for example, and you start replying to emails. If the rota coordinator asks you to cover a day or to cover a shift, instead of saying I can't, they like the word I'm not able to. I'm not able to. So memorize this one. And then you said I glad. It's either I'm glad. It's not I glad.
I'm glad.
And I shouldn't be, you said. You should say I'm not able to do a procedure without supervision. It's not I should. It's not you shouldn't. When you become a consultant, you should. So it's not you shouldn't. Yeah. You mentioned I understand your concern, but luckily you changed your phrases. That's why we don't want to say one phrase. I understand. I totally get it. Yeah, I get your point. So change your vocabulary so you appear more professional. You said that's a good question. That's a very positive thing you say to your patient while you are consulting your patient. You said now I can understand you. It's not wrong, but I get you. I get your point, Mr. Jack. Yeah. But I don't have any other point. I think you answered every single question right. The only thing you missed is balls.
Balls, yes.
Yes. Patient
advice,
liaison service.
Yes.
You know, but when balls is a big dilemma here. Every single consultant, whenever you say balls, they start shaking. So you should never forget balls.
Yes,
and they are very effective. Every patient that's complained to balls, the next day, an email will be sent to the consultant, to the registrar, to the SHO, to the ward manager, to the nurse in charge, to everyone about that complaint. It's a big deal.
I didn't understand.
We have 937 for this in Saudi Arabia.
Yes.
Every day.
So, Umar, BALS is a complaining system. When your patient is not happy, he can contact BALS. When your patient is not happy and he contacts BALS, BALS will immediately send an email to every single doctor, so the patient in the last 4 days.
But could you please say the word again? Patient advice
liaison service. Liaison service.
Liaison.
Yeah.
Advice liaison service.
Ahmad Akasha, very nice performance. Only one thing. The first point when Ali asks you, is it my turn for the operation? And you start to answer his questions, but Ali interrupt you. That didn't make you to say clearly your operation cannot proceed today.
Okay.
You mean it by, you say it by in your words and between the words, but make it clear. Your operation cannot be proceed today. Other thing, I am very happy that you first address the patient concern, then answering his questions. Very nice performance.
Thank you.
Good. Very good. That's a pass for sure, Akasha. If you continue with the same performance, that's a pass. Yeah, Fatah Rahman.
There is a small point only regarding the arthroscopy. He mentions that we will make a hole. I think hole is a little bit scary sentence.
Yeah.
Yes. But so you wrote it in school in a very nice way. We said a divide.
Okay.
Yes, it's very cool and easier for the patient to accept.
Yes. That and we want to just to confirm Fatah Rahman point. We want to memorize it. We will insert a small device that contains a tiny camera into your joint. This will allow us to visualize the inside of the joint. Then we will proceed with the operation. That's a very nice, very simple way.
Very nice, simple.
Yeah, fine, good.
So the next station.
Next station, I think, should be Umar. Total knee replacement. Are you ready for it? Umar.
Yes, of course. Ready
All
all
right.
the time.
All right, cool. That's a positive energy.
Okay, scenario, Mr.
Total
Leon.
knee replacement?
I will be the patient, yes. Total knee replacement, yes.
Mr. Leon arranged for a total knee replacement. He came today for his operation. Answer the patient questions. Address the patient concern. You have 8 minutes and 40 seconds. Okay? Let me put the
Yeah,
timer.
let's start.
You can start.
Mr. Said ولا Mr. Leon?
Mr. Leon,
Mr. Leon.
you are, you look, on you, while you're practicing, say your name. So I want you to practice, say
لا, the patient name.
Patient name is Leon.
Leon.
Leon. Okay.
You can start.
Hello, Mr. Leon. I am Dr. Omar, one of the surgical doctor here. I want to discuss with you the surgery has been arranged. Is that okay with you?
Yeah, that's fine, doctor. That's all right, yeah.
Can you tell me what you have? Did you have any concern or any question
To
regarding
be
the
honest,
surgery?
yeah, doctor, I have lots of concern and issues. Firstly, let's start by the first thing. Can you tell me how long the operation will typically takes?
Okay, that's a good question, Mr. Leon. I cannot determine the exactly time for the surgery, but it usually take a couple of hours, including the anesthesia and recovery time.
All right, okay. As usual, doctors don't give answers. Are they a potential complication I should be aware of?
Excellent question, Mr. Leon. As any medical procedure, there is a potential risk or potential complication like infection, but we can handle it with it. Like infection, we can treat it with antibiotic. Bleeding, we can clotting, we can handle it with blood thinner medication. Pain, we can handle it with painkiller. Don't worry, we will take care of you very good.
Okay, fine. How will blood clots? How will you prevent the blood clots?
I really understand your concern, Mr. Leo. We will manage the blood clots with medication, blood thinner. You need to follow the prescription exactly like the doctor described it, and also we need to keep yourself hydrated, okay, and keeping moving. And also you need to wear the stocking, anti-embolism stocking. We give it to you.
So I will wear. Okay, fine. I think that's answered my question. Can I have breakfast on the morning of the surgery, doctor?
Excellent question, Mr. Leo. It is we prefer to don't eat anything up to 6 hours before the surgery. Okay.
Yeah.
And we need also to take just clear fluid up to 2 hours before the operation time.
What do you mean by clear fluid? Juice?
No, just water. It's
Just
better
water.
just water.
Yeah, I wonder always why you doctors try to make everything complicated. Just say water. I don't like you always try to make everything complicated and very
sorry, Mr.
very vague. Yeah,
that's
clear
my
fluid.
bad. So sorry.
All right. Okay. Can I? Okay, you answer that. Will I be under general anesthesia or spinal anesthesia or local anesthesia?
That's very good question, Mr. Leon. Regarding that, I will let your anesthesia doctor or specialist to discuss any option with you.
Okay, so you don't know the anesthesia. The anesthetist will come and have a chat with me. Is that what you're saying?
Yeah, he will tell you more about the procedure.
Okay. How long will I need to stay in the hospital after the surgery, doctor?
That is also very good question, Mr. Leon. I cannot give you exactly time, but in usual, it takes 3 days. It depends on the recovery time, and we needed to assess you very good before discharge. That including the blood test and assess your knee for ability to get on and off from the bed, and you can do the regular exercise on the regular day.
Okay. When is the when should I follow up with you guys?
Thank you for that question, Mr. Leon. The follow-up will the follow-up will take 6 weeks to 6 months post-operative, and during that, before that, we can arrange with your GP doctor to more assessment. 2 weeks before.
When?
2 weeks.
2 weeks. So I will see my GP in 2 weeks. I just want to make sure I get it right, and then I will see one of you on 6 weeks or 6 months.
Yes.
All right. When I can return to work, doctor? When?
I'm glad to ask you that, Mr. Leon. The exact time to return your work is not clear. It depends on your recovery and the nature of your job. Okay. We will assess you through the recovery time, and when you are fully recovered as soon as possible, we will tell you about that.
Okay. Okay. How soon can I walk after the surgery, doctor?
So sorry?
How soon can I walk after the surgery?
Okay, I will discuss this with your physiotherapist. He will tell you more about that and give you more details.
Can I go swimming after the operation?
It's preferred to don't do any exercise until 6 months.
Yeah.
Okay.
Okay, but you didn't answer my question. When I'm gonna swim?
After 6 months, when you feel it is now you are confident you are better, you can start it gradually.
Okay, when I will start driving again?
That's a good question, Mr. Leon. We need to prefer to don't driving for more than 6 weeks.
Yeah.
That is will be very safe for your knee and for your operation.
Okay, how soon I can travel after my operation, doctor?
For your traveling, you can travel just with a car, bus, and like this. You can travel no problem, but be sure you have regular exercise during the journey. But the traveling by the plane, I prefer to give yourself 3 weeks or 3 months.
Okay, so 3 months.
Yeah.
All right.
Time up.
Time up. Okay. All right, Umar. It's a very difficult one. Lots of question, but you did very good. Okay.
Okay.
There's very complicated question in this station. It's not like a straightforward. I think this is one of the most difficult station in communication, because you need to know about driving, swimming, surgery, all this stuff, and you need to memorize them. Firstly, there's small mistakes. For example, I like the way you say excellent question, good question. That's very good. You are assuring your patient. You said keep it moving. Keep it moving if you want to say, or we would like you to mobilize. And can you pronounce preferred for me?
Preferred.
Preferred, not preferred.
Preferred.
Preferred, yeah. I can give you, you said I can't give you exactly time. I can't give you the exact time. I can't give you the exact time. But if I'm talking to you, I don't know the exact time. Exactly when you like, you're reassuring someone, yeah, exactly. But it's not I can give you exactly time. I can't give you the exact time. We said we need to assess you very good. We need to assess you well. We need to make sure your assessment is fine. We need to make sure you recover well instead of very good. Okay? We need to assess you well instead of very good. I'm glad to ask you that. Your patient asks you. It's not you ask your patient. You should say, I'm glad you asked this question, Mr. John. You did a lot of good thing of saying that's excellent question. You assured your patient multiple times. But I think you need to memorize the swimming, the driving, and the traveling. You need to memorize the sentence, the exact way we wrote it in the school, so you don't waste your time. As you can see, you were not able to summarize to your patient, and you were not able to ask your patient to summarize to you. Why? Because you spend a lot of time in the driving and in the swimming. If you remembered and if you memorize exactly what's written, you wouldn't take that much time. Okay? Yeah. We preferred, yes. So I just want to say one thing. So when we do total knee replacement, usually we'll ask the patient to walk next day. All right?
All the orthopedic procedure, early mobilization is very important.
Yes, that's what happened in real life.
Yeah.
Yes.
We'll
ask our patient to walk the next day, but we will ask the physiotherapy team to assess them first. Unless during the total knee replacement there was a problem, or we found the knee infected, or whatever, there's a specific problem, then, or we did the x-ray and there's periprosthetic fracture or whatever, then we will not ask the patient to mobilize. But if the patient is fine and the procedure is fine, we will say full weight bearing. And then the physiotherapy team will come and ask the patient to move. That's from real life perspective. During your exam, we're just doing our best to make you protected by saying your physiotherapy will assess you and then will let you mobilize. Okay? We can add one sentence. Usually, we will ask you to be mobilized as soon as possible post-operation. In general, unless there is a specific contraindication. So what you should say to your examiner, or when the patient asks when I will be mobilized, you should say, usually we will ask our patient to be mobilized immediately after the operation. However, we need you to be assessed by our physiotherapy team first. Okay? Good. Huge improvement, Omar. Huge. If you just work in this simple grammatical mistake, and if you put time to memorize, I know, Omar, I do teach for 2 years now. I know the criteria of each patient, or each candidate. Yes. I know you don't like to memorize. I want you to memorize. Don't say I will understand and I will come later on and I will say it my word. No. You memorize it. Like you literally memorize it في السنة الثالثة. You memorize it. So you can say it faster. All right? Good.
Yeah, very nice presentation, Omar. I'm so happy that you took your permission at the start. But the only thing I would like to add, Ali covered all the points. When Ali said, doctor, don't give answers. Address his concern first, then answer his next question. Regarding the swimming, you say
Yes,
that
Muhammad, just to add, when I say doctor, don't give answer, you can say Umar.
I'm really sorry. All
I'm sorry for that, but we just want to make sure that we say the accurate information. Okay? You can just let him know. Yeah, we just want to make sure we say the accurate information. Yes, Muhammad?
Regarding the swimming, yeah, you said we will be confident in walking safely around wet areas, but add, Mr. Leon, please wait until your wound is fully healed.
Yes.
Yes, full heal is important. Otherwise, I have no any point. Very nice presentation.
Again, Dr. Muhammad, can you say again?
Regarding the swimming, when Ali asked you when I can swim, you said after you should make confident that you are walking safely around wet area. Add to this point, please wait until your wound is fully healed.
Okay.
Yes.
Yeah, and that's why I asked you, Umar, to memorize what's written in the school. This is also written in the school in details. So you need to make sure the wound is fully healed, and also he can walk safe around the wet areas. Both of them will determine the focus. But Rahman, do you have any point? But Rahman is the third teacher.
he said regular exercise instead of regular movement because no exercise is traveling.
Yes.
Regular activity. I want.
Yeah.
Regular movement activity. Just move your limbs and walking during the journey, but no exercise or activity during the journey.
Okay. Should we go to the next station? The next station, colonoscopy. Okay, Muhammad Sadiq, I think I saw you unmute yourself.
I thought the second station would be me because Umar, I think last week he
practiced, yes.
But it's okay.
Yes,
علي choose him.
بالرد في عمر. Okay.
ويستاهل الراجل يستاهل يا اخي شيخنا يعني.
Okay. خلاص يلا. Let's be clear. So the next two stations, Jehovah Witness usually doesn't come to the exam, and colonoscopy usually also not very common. But as I said, we like if you notice the way I teach, we more focus of show you how to drive instead of making you memorize. So these two will practice them just to improve your language, to improve your cognitive behavior, to improve how you speak and how you adapt. There's high chance you will not see them in your exam, but we're going to do both of them. I think Muhammad Siddiq, you can do the colonoscopy.
Yeah, I can be.
And then where is Fatima? Fatima has to participate. Muhammad, Fatima, can you text please Fatima?
I will text now. No, Fatima.
She is not available.
فتح الرحمن
يا زولي قروش حلال دوس
حلال
لا it doesn't work like that والله. She has to attend.
She should practice really.
She has a fear of facing.
No, she has to attend. So it doesn't work like that. Muhammad, let's have a meeting with Fatima after we're gonna have a meeting after we finish.
I think
the time of her exam.
Yes.
We're gonna have a meeting with her later on. Okay, let's do the next station, colonoscopy. Muhammad, scenario and timing, please.
Okay. Mr. Jack, a 54 years old undergoing a colonoscopy. When reviewing the clinic notes, it is observed that he has been experiencing rectal bleeding and weight loss over the last 3 months في الدوام.
Yes, okay.
Okay, what to do? Answer the patient questions, address the patient concern. Let me go the timer. You can start.
Okay. Hello, I'm Dr. Muhammad. I'm one of the surgical doctor.
Hi, doctor.
Nice to meet you, Mr. Jack. As I understand, you have a procedure today. So can you tell me what do you know about this procedure so far?
Yes. Ali, you'll be the continue.
Yes, I can be the patient, Muhammad. Yes.
Yeah, from what I get.
Yes, doctor. Yes, Muhammad, continue. Yeah.
From what I gather, Mr. Babikir wants to use a camera to investigate the source of bleeding in my bowel.
Yeah, that's right, Mr. Jack. So this is, we call it colonoscopy. This is like a flexible tube attached with a tiny camera will be inserted through your back passage, and this camera will allow us to see what is going on inside your bowel, and to see the lining of your bowel, and to diagnose any abnormal issues. During this procedure, Mr. Jack, you will receive sedation through a vein to make sure that you will not feel any pain.
But
also,
doctor,
you will
regarding sedation, will I be awake during the procedure?
Actually, you will be awake, but you will be like, we will ensure that you will be drowsy, and to ensure that you will not remember anything. In general, it is not a painful procedure. Also, you will receive a drug to help to evacuate your bowel. We call it laxative, to ensure clear bath.
Yeah. So, doctor, are there any alternative procedure? Because I heard from my friends they may cause some perforation or cut through my as a large bowel.
Yeah, your concern is valid. Actually, Mr. Jack, there is an alternative. It's called barium enema. But let me tell you that the second option, it not gives the information which we needed. It gives usually less information than when we comparing with the colonoscopy. Moreover, with barium enema, we cannot take a sample, while in colonoscopy, we can take a sample and we can examine. So it is important for you. Colonoscopy is fit for your condition.
From what you say, that sample is very important to determine my condition. So I am okay with this colonoscopy. But can you tell me, is there any other risk?
Actually, this is a good question to ask, Mr. Jack. Like any other surgical procedure or invasive investigation, yeah, there is some potential risk, like there may be some bleeding. Also, there may be a tear in your back passage, and also you will be pain. But mentioning this risk does not mean it will happen, because here we have most experienced and skillful surgeon which allowed to do this procedure.
Doctor, you said one of the risks is bleeding. So if I bleed during the procedure, how you can fix that? How you can treat me? Maybe I die.
Your concern is valid, Mr. Jack, but rest assured, we are able to deal with any complication. Don't worry, you are in safe hand. And if bleeding happen or perforation, we are able to manage you. So regarding these issues, don't worry. We just mention it to know it, but this does not mean it will happen 100%.
Okay, thank you, doctor. So can I eat and drink normally beforehand?
Okay, this is a brilliant question to ask. Actually, it is better to keep on the low fiber diet until 2 days before surgery, and 24 hours before surgery, stick to the clear water, just water, to give us, a clear to see what is going on in your bowel.
So what
This
about
will
my
help us.
so what about my tablets that I took for blood pressure?
Yeah, I'm glad to ask this question also. Regarding antihypertensive, you need to use it, and even at the day of the surgery, you can use it just with sip of water. So don't stop the antihypertensive.
And what about my aspirin?
Yeah, your aspirin, it is very nice to mention this for me. The aspirin is increased, Mr. Jack, the risk of bleeding. So I advised you to stop it 7 days before surgery to decrease the risk of bleeding. And you can resume it just after surgery.
Yeah, you mentioned that you will take sample from my bowel. So can you tell me what the exact time that I will receive the result?
Yeah, usually the result will be available in 2 weeks time frame, and rest assured I will give you appointment within 2 weeks to discuss the result when it is available.
Doctor, I'm really worried about the result of this sample. Could be cancer or something serious. I'm really worried about this.
Well, I'm truly sympathize with your condition, Mr. Jack, and your concern. But my advice is to wait until the result become ready or available in our system, and I
Okay.
will give you appointment. We will discuss about these issues. Yeah.
Okay. I will thank you so much, doctor.
Okay, thank you. So, Mr. Jack, there is a consent outlining that about the risk and benefit, and you are agreed to do it. Can you sign it? Are you happy to sign?
Okay, I'm agreed to sign it. Give it to me, please.
Okay, that is perfect, Mr. Jack. So now can you please summarize what we discussed just to make sure that all the information we talked about, it's clear for you?
Okay, I'm scheduled for a colonoscopy, as you said, and you will insert a flexible tooth through my back passage, and you will take a sample, and you will give me a result after 2 weeks. That's all what you said.
Yeah, that's right, Mr. Jack. So let me summarize it for you. Mr. Jack, you will do an investigation or a procedure called colonoscopy, which involved passing a flexible tube through your back passage. And this will allow us through a camera to visualize your bowel.
Time
And
up.
also we discuss about the risk and benefit, and the result will become ready within 2 weeks.
Thank you, doctor. You can go to the next station. Yeah. All right. Good. الليلة أنا والله مبسوط بسطة شديدة خلاص. Very good performance from everyone. Very fantastic. ما شاء الله تبارك الله. It's very fantastic. So قفلنا بالطبلة history communication. I'm so happy you mentioning this risk doesn't mean they're gonna happen. This sentence, you can find a registrar or consultant here. Whenever they try to whenever they try to speak to the patient get worried. And this sentence is a magic pill. Every single patient deserves to hear this sentence. Mentioning this risk, I remember one day, someone is talking to the patient. This operation we may need. It was hemiarthroplasty. Can lead to anesthesia risk. Can lead to fat embolism. There is a chance the hip may be fractured. And the patient looked at Michael Lee, and he said, "Doctor, why are you doing it then?" And he was complete British white person, green eyes. So what's the point of doing this operation? You're so rude. How you talk to a patient like that? And I was so happy because I dislike You know, surgeons sometimes they don't have communication skills. They are tunnel vision. They just want to do the operation. That's all what they care about. But you should consider about how your patient feel. You should say, I will mention this complication, but that doesn't mean they're gonna happen. 99% is not gonna happen, but I have to mention them to you just for legal matters. So mentioning these mistakes doesn't mean they're gonna happen. I love this sentence. I like it from practical point of view and from exam. And every single examiner you have your exam with will love this sentence. You also said this brilliant question, this good question. The only, I think, grammatical mistake you said aspirin increase or increasing. I don't remember, but aspirin increases the risk of bleeding. And I'm so happy you made sure your patient signed the paper, because while we were teaching on our previous courses, the candidate will discuss with the patient, summarize and everything, but they forget the main purpose of their consultation, which is signing the paper. So imagine you working in ward, and you came to the patient, you consulted him and everything, you told him the risk, but you didn't sign the paper. And tomorrow morning, the patient went to theater and no consent form. Yes. So you have, even for your examiner, now, Mr. John, I would like you know the paper that you took, that we say you're just going to use for drawing. Now, I would like you to sign on this consent. You give it to him like this. You make sure you show your examiner, you know exactly the point of this conversation, which is signing the paper. But otherwise, I don't have any mistake. That's a very brilliant performance.
Yes.
Thank you.
Yeah, very nice presentation, Muhammad Sadiq. You know, I interrupted you while you explaining to me the procedure. So you cannot remember the laxative, but you surprised me. You didn't forget the laxative. The other thing regarding you said couple of times because I am your patient. I hear a lot of So as Ali said, take a silence for 2 to 3 seconds to know what you will say, then say. Otherwise,
Okay.
fantastic presentation.
I say evacuate. Did we say evacuate in our school, or we say emptying?
Empty.
Yeah, evacuate. I wouldn't say evacuate is a medical term.
Yes.
But I think emptying is nicer and simpler than evacuating. Yes. All right.
So
Tear is better to set cut through or perforation. It's very simple.
Yeah. Instead of tear, fine.
Yeah.
All right. Last station.
Last
Jehovah
station.
Witness.
So who will take this session?
Muhi,
Okay.
Muhi. I will say next week we'll start with you, Habiba, okay?
Habiba and Fatah Rahman.
Yes, next week we'll start with Habiba and Fatah Rahman. Next session. I had a very nice story of patient Jehovah Witness, and we scheduled him for procedure tomorrow, and we have one of our F1, those are internship, and the nurse was arguing with him to take the blood for group and save, and the nurse was saying that he's for theater tomorrow, he needs group and save, and he called me, and I said, this man is Jehovah Witness. Why are we taking the group and save? Even the nurse said, yeah, we still need to take group and save. I said, we're not gonna take it. If anything happen, I'm responsible, and I documented on the bigs. So the main purpose of Jehovah Witness, it's a very important station, to be honest, and you will find it in practical. When you come here, you need to ask every single patient, are you Jehovah Witness? You don't want to prepare the blood and discover later on your patient is Jehovah Witness. We write it on the file, Jehovah Witness. We write it everywhere. So it's very important. It should be on MRCS OSCE. I don't know why they don't bring it, but it should be. It's very important one. All right? So for those who doesn't know, Jehovah Witness they believe they are part of Christian. They believe if you took blood, you will not go to heaven. I think. So they don't ever take any blood. alright.
دكتور حتى اللي هي الأوتو بلاد اللي هو معرفش كان اسمها
Salva.
Yeah.
Okay.
What, Habiba, what did you say?
I was saying even auto blood, I don't remember what is its name. I think still salvage or something like this.
Autologous salvage, yes, autologous salvage. Yeah.
They also don't take it?
I don't know. That's a very good question. I don't know.
They refuse the other blood because they think that not trust other blood may be contaminated.
But her question, which is a very brilliant question, is
yes.
Do they take their blood?
They do. They do.
Are you sure?
Yes.
Perfect.
I will do that now. Okay, let's do the station, Muhammad.
So the last station, Jehovah Witness, Mr. Robert, 62 years old, scheduled for brain tumor excision. Explain the patient the risk of surgery. Ask the patient for permission for a blood transfusion. Okay, I will be the patient and examine at the same time. Okay. So
okay, now
yeah. Let me put the timer. You can start.
Hello, Mr. Robert. I'm Dr. Muhammad, one of the surgical doctors here. I would like to discuss with you the upcoming brain tumor operation. Is that okay with you?
Yeah, that's fine.
Okay, Mr. Robert. So, in your own word, could you just describe for me what do you know about the operation that you are going to have?
Yes, I know a little bit. I know I have an operation to remove a brain tumor. So could you tell me more about the operation?
Exactly, you're right. You have operation to remove a brain tumor, and it will add a bit of information. It might be beneficial for you. So we are going to remove a brain tumor, and this operation has a risk of bleeding. So I would like to take a permission for you to store the blood, and just in case if you have
no, I will not accept blood transfusion, doctor. I will not accept it.
Completely understand your decision, but could you tell me why you don't want to take the?
Due to my religious belief, even if it becomes necessary during the procedure, and that may help me, I cannot accept receiving this blood transfusion.
Yeah, I completely understand your faith background that is not able you to take the blood transfusion. And I would explain to you a bit about the risk of not having the blood transfusion during the operation.
Yeah, you can, but I need to make you sure that I will not accept blood transfusion even if I can die during this procedure, doctor.
Would you like to know the risk of not having the blood transfusion during the operation?
Yeah, you can tell me.
Yeah, because while we're doing the operation, removing the brain tumor, and this area is highly vascularized, so we need to visualize the tumor, which we need for us to deal with a lot of blood vessels. That's make the risk of bleeding is really high, and if the bleeding happen and you don't want to take the blood transfusion, that means we are going to cease the operation, and then the brain the tumor from your.
Yeah, I
Is
know
that okay?
Yeah, I know that, and I don't want blood transfusion. Sorry, doctor.
Okay, I totally respect Mr. The not taking the blood, and just to complete the understanding, could you explain for me that what we have?
Yeah, you said I will undertake this operation, which you can remove the tumor in my brain, and you said that I may have bleeding during the procedure, and that may affect my life threateningly, but I didn't accept.
Okay, exactly. To go forward, could you just sign for me this paper which said that you don't want to take the blood instead of life-threatening?
Is it mandatory to sign, doctor? Can proceed without it?
Yeah. Unfortunately, we can't proceed the operation without signing the paper. Is that this paper is saying that you are going to take the operation instead of you know that the life saving blood transfusion you don't want to take it.
Okay, so I can sign it. Give it to me, please.
Okay, sign it.
Yeah, this is my sign. So,
thank you.
So, doctor, how can you ensure that the patient is capable of making this decision?
We perform the full capacity assessment for my patient to make sure that he understands and receiving the information and can make a decision about the information that he received.
Whom would you notify about this decision?
Neurosurgeon, anesthetist, and the theater team.
And what precaution can be taken for pre-operative, intraoperative, and post-operative for your patient?
For pre-operative, I will check his hemoglobin, erythropoietin, and I will give him IV fluid and tranexamic acid. Intraoperatively, I will try to do the operation quick as much as I can. And post-operatively, I will check or make sure his hydration, he's well hydrated, and I will check his hemoglobin, erythropoietin again.
Okay, and how would you conclude the discussion?
By check the patient understanding by asking him to recap after me, after the discussion, what we have discussed.
What we call this?
Yeah.
What we call this when you ask your patient to recap and retain the information?
Capacity assessment.
Okay, perfect. The last question in this session, so you can move to the next. You have 2 minutes and 50 seconds.
Okay, if this happened to your exam, you're just gonna sit there and keep your mouth shut for the 2 minutes. If your examiner started, Dr. Muhi, where are you from?
Sudan.
Sudan. Okay, all right. And which university did you study in Sudan?
Al-Fashir University.
Fashir. Okay, all right, all right. And how is UK? Do you like it? Is it nice?
Well, I like it, but comparing to my country, I used to use in the hot weather, but the cold weather, I don't. For me personally, I don't like the cold weather.
All right. Okay, fine. Okay.
From the tropical area, I'm from Sudan.
That's all right. Good. I'm just giving you a taste of what's gonna happen. Okay. So if your examiner,
is he going to ask me additional information like that inside using that?
Yeah.
Yeah, he can. Don't ever, in any single station, say, how did I perform?
Okay.
Don't ever, Umar, that's for you. Don't ever say, how did I do? Or what is my score? Or how I performed. بسقطوك طوالي. He asks you about your life, you answer. Some examiner will not ask you anything. Don't ever also, your examiner sit like this and say, from where are you, doctor? Don't do that. If your examiner started to ask you, you answer. If your examiner kept silent, you keep silent. Just to finish the two questions. So for autologous salvage of the blood, I just looked it now. So some Jehovah Witnesses accept their blood, and some don't accept their blood. All right. Now, Muhyiddin, if you have a Jehovah Witness and he has a kid who is 5-year-old, and the kid is on theater for a splenectomy, will you transfuse blood against the mom and dad?
Yes.
Okay, Fatah Rahman, yes, Muhyiddin.
It's called type 4, I think.
Sorry?
It's called type 4? Type 4.
No. Your patient is...
Yes.
Yeah,
by
so
the
mom and dad tells you not to transfuse blood. Patient blood pressure dropped, he's bleeding, ruptured spleen. Will you transfuse blood?
I will, ask two consultants to sign you.
All right, Umar?
The same Muhyiddin opinion.
Okay, Habiba?
If IV fluid and everything else didn't work, yes, I will emergency, yes. If it's not emergency, court, refer to the court.
Oh, okay, yes. Okay, fine. So the right answer is, firstly, you don't wait for this to happen on operation. Firstly, the child came from an operation, so with suspected ruptured spleen. Before you take him to theater, you tell mom and dad, look, we may need blood. Mom and dad say no blood transfusion. You immediately speak with the legal team of the hospital, take it to the court for blood transfusion if needed.
Before the operation.
Why are you taking him to the operation? You're not going to delay the splenectomy. That's for the emergency case. If it's an elective case, you also do the same. If the dad and mom are Jehovah Witness, they have right to decide on themselves, but they have no right to decide on a kid less than the legal age.
Yes.
18.
If the kid in the legal age, 16 or 17 or 18, according to the country or the state, then if he or she is 18 and she said I don't want blood, she's conscious. She can take the decision. But for minors, mom and dad cannot decide on blood transfusion, especially to save the alive. All right? You immediately say this will be escalated to the legal team and it will be taken to the court. Okay? Yes. For your performance, Muhyiddin, very good. Fantastic. You said, I completely understand your decision, which I loved. I was afraid that you're going to say, I completely understand your concern. You said, I completely understand your decision.
This is a decision, not concern, yes.
Yes, it's a decision. It's not a concern. I was anxious that you're going to say, I will completely understand your concern. In this case, that means you didn't understand the situation and you're just memorizing what you say. That means you know how to drive right and left according to the situation. You said also, even though if you don't give your patient a chance to say, I don't want you to explain the risk. You ask him, are you happy for me to explain? No, you explain the risk regardless. And don't make it like you're giving him a choice, not because if you didn't explain the risk and he went to theater and he died, and next day his daughter, or let's say he didn't die, let's say he went to recovery and he stayed for 3 months for the recovery and stuff, and after he recovered, he will sue you. He will say, this doctor didn't tell me that I can die, or this doctor didn't tell me that I can go to I can lose my life, or I can go to the recovery. They will come to you. You will say, I asked him to explain to him to the risk, but he said no. You will not go to prison. They will not take your GMC, but you're still going to look bad. Do you understand?
Yeah, even the guilty of my patient is going to have a stroke and neurological deficit after without explaining to him.
Yeah.
He might change decision if I told him that you might have a paralysis, stroke, or stuff like that.
So yes, exactly. So you mentioned. I remember. Okay, now I'm giving you. I'm not going to say the name of the patient just to follow the GMC guideline, but we have one of our patients, Jehovah Witness, the family Jehovah Witness, and the lady Jehovah Witness. We had a long chat with the lady, and you know what did she say? She said, I would like to be transfused blood if I need it, but I don't want my family to know.
Oh no, yes.
So you don't go with the family. She was very old lady. That's me. Every single patient comes to you, regardless of her situation. If he's doing like this, if he's not speaking, if you go and you test your patient, you speak to your patient directly. Mr. John, I know you are Jehovah Witness. I would just want to confirm with you, even if you think he has no capacity, you discuss that. All of this is not MRCS. I'm giving you life experience. Okay? You take a direct consultation with your patient, even if all the documentation says the patient is non-verbal and he cannot speak and he has a stroke. You speak with your patient. Once you confirm your patient doesn't able to speak, then you speak to the family. Okay?
In this case, if he refused to.
Yeah, Omar, say that again.
If he refused.
The patient.
Yeah.
Okay, fine. The risk, yes. Yeah, you explain the risk. And if he's still refusing to take any blood, that's fine. You take him to the. Yeah.
You ask him to, can you summarize or explain the risk which I discussed with you? He said no.
Do you understand? Let's say you are the patient. Let's do it as a role. Mr. Umar, do you understand all the risk I mentioned to you?
Yes.
Yes.
You said no. Let's say you are the patient. Let's imitate the situation. No. Okay, Okay, that's fine, Mr. John. I wouldn't be able to sign this consent unless I make sure that you understand everything. So do you understand then? Do you understand what I said?
No.
All right. So
in this
case, I repeated already. In this case, I think you don't have capacity to take your decision. So I will involve your family in your decision.
That's good, yeah.
Yes.
Does that mean
يلا طيب تمام. Now we have 5 minutes for general discussion عشان نلحق صلاة العصر.
Yeah.
I think Muhammad, you can stop the recording.
Yeah, Muhi.
Yes.
Okay.
Fatah Rahman, what do you want? Muhammad, you did reply to Muhi, yes.
I have nothing. I think you covered all the point. Very nice presentation, Muhi. Yes, just only add the good communication during the intraoperative precaution for the blood transfusion. You said you should do the operation quick as fast as you can, but add the good communication between the teams. Otherwise, very nice presentation.
All right. We will add these 2 questions for Jehovah Witness station. Yes, Fatah Rahman.
I like your tone. Today is excellent tone. Especially your starting conversation.
Yeah.